resolution we had during our presidency, 2565, and the previous French one. And I think we've got to a point now where we're seeing more than half the deaths and infections from COVID occurring in humanitarian areas. So it's very important to focus on the humanitarian. You think about the situation in Ethiopia, Syria, where we've just got the cross-border access, where getting vaccines across will be very important, and places like Myanmar, where unchecked, in a couple of weeks, probably half the population will be infected. So I think a really timely discussion, of course, against the backdrop of the wider efforts to get vaccines manufactured to COVAX, out to countries, and then into arms. So there's still a lot to do there as well, but we'll focus on the humanitarian side this afternoon.
Ambassador, what concrete measures are needed to kind of prioritize getting things moving in the right direction? Because vaccine distribution's been very unequal, and in a lot of contexts there have not been ceasefires, but there's been more insecurity globally.
So I agree with you. We haven't seen a lot of ceasefire yet, but as you say, we've got to get manufacturing back to where we intended it to be. We've got to get the supply chain logistics sorted out, the distribution sorted out, but then to make sure that we don't overwhelm recipient countries with too many vaccinations if their health systems aren't equipped to deal with them and get people ready to put them into their arms. So quite a lot to do. Anyway, see you later. Thank you.
Thank you, Ambassador.